tonight. I'm Dr. Magaziner, and I've been in practice here for about 33 years almost now, practicing what's called functional and integrative medicine. And so we'll talk about some of those concepts and what they really mean. Tonight's topic we'll talk about is, are you sick and tired of feeling sick and tired? So how many of you have all the energy that you want to have? Good, good. 2 of you. That's great. Well, let's hope by the end of tonight I give you enough tools that makes it so that the answer is all of you have enough energy, all the energy and vitality that you really want. So we're going to talk about how to get to the root of the problem, because fatigue and lack of energy, lack of vitality is probably the #1 complaint that any doctor sees in his or her office. It's the #1 complaint. Whether you're an oncologist, a gastroenterologist, a GP, cardiologist, neurologist, it doesn't matter. It's the #1 complaint that most people will complain of in the doctor's office. And it's also very difficult to figure out how to fix this, because the causes are so diverse. The causes are multifactorial. It's not just one cause. It's not like, certain conditions. You can say, all right, this is caused by A, is caused by B, or whatever. No, there are so many different conditions or causes of what may be triggering fatigue and feeling tired all the time. So we'll talk about some of these things and what we can do about it. So I'm going to first present a case here. And this is a real case. This is a lady that came to me about 3 months ago. She's a 40-year-old lady. And she came to me, first of all, with her past medical history. And she tried to tell me all this stuff. And I'm like, oh my gosh, what am I going to do for this woman? She came in and told me she's had 5 concussions. And now she has seizures. She said she had traumatic brain injury. She was hospitalized for what's called liver failure, kidney failure. She was in ICU for these things. And she also had a condition known as rhabdomyolysis, which means like her muscles were damaged and wasting away, basically. Furthermore, she was borderline diabetic, and she had pneumonia 6 different times in her lifetime already. 2 fractured ribs, and she had a history of endometriosis, which is a uterine problem. For those who don't know the medical terms here, I'll try my best. And she was also told that she had an autoimmune disease. So she told me this is in the past, and I'm like, oh my gosh, why are you seeing me? So then she started telling me what is currently her problem. Because these are all things like she's had over the years, and I was like saying, I don't know what to do. And then she told me what her current problems are. And they weren't much better than her previous problems. So current problems, she said, hey, she has terrible, debilitating headaches that cause her not to function half the time. She also said she has so much fatigue that she can hardly get out of bed, and she might sleep 14 hours a night and still can't move and still has no energy in the mornings. Top of that, she said she couldn't take care of her. She has a 4.5, now he's 5-year-old son. She said, I can hardly take care of him. I can hardly be a wife to my husband. She said her moods are all over the place. She has night sweats. She was receiving what's called trigger point injections from another doctor because she was having severe nerve pain in her right leg. And she was having terrible abdominal pains and bloating, and saw gastroenterologists. And she's seen, by the way, many, many doctors over the years for all these different conditions. And then she said she has frequent urinary tract infections and rectal bleeding as well. So as you can see, there's what we call multi-organ involvement, meaning different organs are probably involved in something like this. It's not just one item. So someone just walked in. Like, let me show you, I was presenting a case, and I was saying a woman walked in about 3 months ago, and she had all these problems in the past, and make matters worse, they weren't much better at this point. This is what her current complaints were. And I was sitting there, I was ready to throw my hands up, like saying, what am I going to do for this lady? And I wasn't even sure what to do. So we do get cases like this all the time, because we get everyone's failures. We get people who have been everywhere and have pretty much failed everything else. And so that's why they end up here. So at the end of the talk today, I will tell you what we did and what the results were. So you have to stay to the end. You can't leave. And by the way, speaking of not leaving, I want to tell you that you all have a packet here. And in the packet is a lot of good information. And make sure you take a look at this stuff when you get home. Because #1, you get a discount on any supplements you'll buy here in the future, which is nice. You'll also have a referral card for a friend or family member so they can get a discount. And we also talk about what our next Wellness Wednesday will be. And usually every month we do this talk on usually a Wednesday night. We call it Wellness Wednesday. It's commonly the last or second to last Wednesday of every month. And the upcoming one in a month from now, which is September 25th, is the date on here? yes it is on, it's called Weeding Through Medical Marijuana. So we're going to talk about medical cannabis and the applications for that, which is it's quite vast today, by the way. And then to let you know that my health coach, we have a health coach that works here with us, with me probably 13, 14 years now. She's putting together a series of wellness classes that you're all invited to, and you can look at that. And there's a couple other brochures and flyers as well. So when you get home, you can take a look at these things. Anyhow, so when we're talking about fatigue, we have to expand our horizons. Because there's not one cause, we have to start thinking of global cause. We have to start thinking, well, what are the different ways, what are the different things we can do to help assess, first of all, why a person's so tired, and what can we do to help alleviate that fatigue. So we have to look far and beyond the traditional and basic testing. So how many of you have been to a doctor with fatigue? And if so, what kind of testing did they do? What did your doctor do? Yes.
Well, basically, they just give me a normal blood test, and then they tell me, "Oh, you're fine."
Right. Okay. How about you? Back.
Blood tests as well.
Blood test.
You know, if you're deficient in any supplements or any minerals or vitamins, you know, supplement with those items.
Right.
Which can take the edge off.
Right.
But root causes, not a.
Don't steal my lecture, Wayne. Don't steal my lecture. No, I'm going to talk about that. So the point, she went to a very progressive doctor, obviously, because she said he checked some of her levels of different vitamins and minerals. 90% of doctors, or more than 90%, won't do that. And your doctor didn't do that. He just did probably the basic testing, which we'll talk about that. And he said, hey, I can't find anything wrong. You're fine. Well, just because we can't find anything wrong doesn't mean you're fine. It means he can't find it. It doesn't mean you're fine. So anyhow, so we have to think about what's going on inside the internal environment and also what's happening outside. We'll talk about what I mean by that, the internal environment as well. So we have to go beyond the current limits, the current mindset of what we should look at when someone has fatigue. So conventional testing generally looks for, they try to treat the name of the diagnosis, meaning if you have, let's say, high blood pressure, what do? They give you a high blood pressure pill. But that doesn't tell you what's causing high blood pressure. It simply is treating the name of the disease. It doesn't have anything to do with causes. If you have heart disease of some sort, they might give you a heart pill, but it doesn't tell you why you have that condition in the first place. If you have diabetes, they give you an anti-diabetic pill. Once again, has nothing to do with what's triggering the condition. So fatigue is the same thing. They just tell you here, take an antidepressant, you need more exercise, which is very good. But they're not really looking at the causation. They're looking at only the root, the tip of the iceberg, I call it. And they're looking at the result of some type of imbalance in the body rather than addressing, first of all, assessing and then addressing what some of the underlying causes might be. Also, conventional medicine is quite reactive, meaning, hey, let's wait till you have a disease and then we can try to treat that disease. Well, it's not really treating the disease, it's putting Band-Aids on. It's basically covering up the symptoms. It's not really alleviating the disease. And one of the things I saw when I was at medical school that got me interested in the field of integrative and functional medicine, which is what I do here basically, is the fact that I saw so many people who are so sick in my hospital and in the clinics that we were working in, and all we were doing is giving them medications for their disease that they had developed. And then I had to give them more medicines to offset the side effects from the previous medicines I already had given them. And so we weren't really getting into causes. It just bothered me. And I said, you know, this isn't the right way of handling things. So anyhow, so traditional medicine is very reactive. It's not proactive. Very rarely does a doctor sit down with you and say, hey, here's what you need to do to stay healthy. They don't give you a health plan. They give you a disease-oriented plan most of the time. Next thing is they wait, I mentioned, they wait for disease to develop in order to address your concerns. So, you know, a lot of times they say, you know, let's say you have a cancer patient and he or she's doing well with certain treatments. And they often say, well, you know, you're in remission right now. I'll see you in 6 months. We'll run CAT scans, we'll run MRIs, PET scans. And what I'm getting at is they wait till those are abnormal and then they say, oh, we have to get back on treatment now. Instead of putting you on sort of a health plan to say, we want to try to prevent and protect you from getting that cancer back, because they often do return. Also, the basic labs, which is what you were sort of alluding to a moment ago, the basic labs that most doctors will do in their office when you have fatigue or most complaints are really mostly just these first two, and if you're lucky, the second and third. If you're really lucky, they may do the fourth. I'm sorry, it's the first two, third, fourth, and then, yeah, I can't count. So anyhow, so they'll do what's called a CBC. You guys know what a CBC is? It's a complete blood count. So it looks at your red cells, white cells, platelets, and other aspects of that. They'll look at it as CMP, which stands for Comprehensive Metabolic Profile. That simply looks at your liver function, kidney function, electrolytes, and proteins, mostly. But let me tell you this. Those things aren't abnormal until a late stage of disease. For example, you don't have abnormal liver function, which can cause fatigue and cause many other things, but you don't have that till a later stage. So once again, we're trying to pick up things earlier. Lipids means your cholesterol and triglycerides and different kind of lipids, different kind of cholesterol. But there's some problems with that testing too, and I will show you that later on as we move ahead. So these are the basics, and they might do a thyroid if you're lucky, and they should do a thyroid test. And once in a while, I'll do maybe a B12 and folate because the patient may ask for it. But if you don't ask for that, they may not even do that one. And B12 and folate aren't usually too low in the blood anyhow, which brings up another point, because you have to look at the right place in the body to find where there's problems. So let me give you an example. Serum levels, which means just plain blood levels of B12, are usually going to be pretty normal most of the time, in spite of various factors. But B12, there's other more effective ways of looking at it than just your serum level. For example, I had a lady in today, and her doctor ran a serum magnesium test, because that's all he knows. It's we learn in medical school, run a magnesium test if someone has a seizure, for example. But they only look in the serum. Serum means like the blood itself, in the fluids of the blood. The problem is 95 to 99% of the magnesium in the body is not in the serum. It's in the cell. It's an intracellular mineral. So if you only look at the serum is probably going to be normal 95% of the time. But if you look inside the cells, they may not be normal. So what I'm getting at is each of the different minerals and vitamins and such and other things that we look at, it's very important you look at it at the most efficient and effective way, because you're going to miss it otherwise. You're going to miss the deficiencies or excesses depending on what we're looking at if you don't know where to look at it. And unfortunately, in traditional medicine, we're not often taught what are the best approaches are for looking at functional levels of your body. So anyhow, we also mainly treat in conventional medicine. How do we treat? Medicines, right? In this country, that's how you treat, generally speaking. But if we lived in other countries, by the way, that probably wouldn't be the first method of treatment. There's other systems that they use, whether it's dietary changes, whether it's acupuncture, whether it's herbal medicine, whether it's homeopathics. They might be at the forefront before we use prescription medications. And I'll talk about prescription medications in a second. But many of these medicines, one of the first side effects, the most common side effect of many meds is what? Is fatigue. So, you know, so many patients, especially when you're on more than one drug, and so many people are on what we call polypharmacy, where they're on 2 or 3 or 5 or 7 different pharmaceutical agents at once. And this is partly why people are walking around in such a stupor, and they can't function well, and they're dizzy and lightheaded. They're fatigued all the time because the body can't handle this. And as we get older, our detox systems and our ability to even withstand with all these different medications starts to decline as we get older too. So we can't handle it so well. Anyway, so let's take a look at some of the medications, some of the issues with medications versus what I tend to use are more nutraceuticals, okay, which are more natural agents. Do you want to put in the air? Is it hot in here? Is it comfortable? Okay. All right. So anyhow,
you
so
haven't been outside in the rain.
Well, I haven't been out in the rain. You're right. I got here before the rain. So anyhow, let me tell you a little difference between pharmaceutical agents and nutraceuticals. So pharmaceutical agents, how do they generally work? They generally work by blocking, disabling, and inhibiting normal enzymatic reactions or normal metabolic pathways. And they're even named that. What are they called? Calcium channel blockers, ACE inhibitors, anti-inflammatory agents. All right, so most drugs are called, or they're kind of antibiotic, you know, against bacteria. So the point is that most pharmaceutical agents work, if they work, by blocking and inhibiting normal bodily reactions. On the other hand, most natural supplements and nutrients and nutraceuticals generally work in a whole different fashion. They work by assisting and enabling and enhancing normal metabolic pathways. And that's part of the reasons why when I see patients and I put them on something, let's say magnesium, they'll sometimes say, you know, you put me on that for my high blood pressure, which I sometimes do, but now I'm not getting muscle spasms anymore, or my energy's picked up. And it's because these nutrients feed into multiple pathways within the body. Something like magnesium, for example, feeds, it's an enzyme that feeds into over 200 different enzymatic reactions in the body. So it works in so many different pathways. It may help high blood pressure, it may help muscle spasms, it may help with diabetes, it may help with energy, it may help with sleep, because these pathways are all aided by this one element called magnesium, just as an example. But when you use pharmaceutical agents, let's say you take a stomach blocker, an acid blocker, right? So it may block the acid, but at the same time, it's inhibiting the ability of your nutrients to get absorbed effectively. Okay? You don't absorb the calcium, the magnesium, the zinc, the selenium, and many other B vitamins often. So what happens is the patient may slowly develop chronic disease, including fatigue and including many other things, because it's not allowing the body to function appropriately how it's supposed to function. So it's a very different way, different mindset when you're comparing strictly conventional medicine to more of an open-minded functional medicine type of practice. We take a look at some of the common drugs in America. First of all, it's been estimated that pharmaceutical agents, prescriptions primarily, probably contribute to over 200,000 deaths per year in the United States. And this isn't illegal drugs. I'm talking about legal, properly prescribed prescription medicines. And you guys have heard, like in the past, when certain medicines were probably taken off the market after a period of time because people developed, you know, cardiac problems or liver problems or kidney problems from it. Unfortunately, we hear those things, but some people die from that stuff too. And this is strictly deaths. That doesn't even include those who are getting other side effects, which can include, you know, the fatigue that we're talking about here tonight, or the muscle aches and pains, or headaches, or anything else. These are people dying. So the proper use of prescription medicines account for, it's the fourth leading cause of death in the United States. Approximately 600 people die every single day, because that's what that equals. You divide it by 365. About 600 people die every day because of prescription drugs. Now, if we heard on the news every day, on CNN, and everywhere else, all the Fox networks, that 3 planes crashed every single day of the week, let's say 200 people on each plane, and 3 of them crashed every day, do you think we just let that go? After a week or 2 or 3 or 7 or 12, people just not, or would there be an uproar? I think there'd be an uproar, all right? And I think we'd probably try to do something about that. But for whatever reason, this gets swept under the carpets, and nobody seems to be alarmed by this. There's too much, a lot of money, a lot of politics, et cetera, about it. But yeah, but these are real facts. That's what's been estimated in many of the studies that have been published now in regard to the pharmaceutical industry. And so we have to start looking for other options. And that's what we're all about here, is looking for options that are safer, more effective, and gentler on the body. All right? Now, part of the problem is that traditional testing and traditional treatment is mainly, as I said, looking for late-stage disease, and it's not really looking for underlying causes. And that's partly why they just cover it up, because they're not looking for causation. They're just looking to cover it up so we can move on. So one of the most commonly prescribed drugs, as some of you might know, are called statin drugs, right? Like Lipitor, Zocor, and some of the others. So why do they use this frequently? Because people have high cholesterol, so they put them on this drug. There's so many other options for how to lower your cholesterol levels and how to bring up the good, healthy cholesterol levels. So one of the biggest problems with this drug is it contributes to fatigue. Why? Because it depletes something from our body called coenzyme Q10. Has anyone ever heard of CoQ10? Good. We have a pretty bright crowd here. So Q10 is something that works in something called the electron transport chain. It's something that works in what's called the mitochondria. I can't help using some of these medical terms here because it's just part of how it's only discuss some of this stuff. But yeah, so we have in our every single cell thousands of things called mitochondria that helps us make energy. It's called ATP. And these mitochondria are so important that they account for 10% of our body weight. So if we weigh 200 pounds, approximately 20 pounds of our body is made up of these mitochondria. So if we give a patient, and the mitochondria depend on coenzyme Q10 to work properly. Okay, CoQ10 is an enzyme. So if we give a patient statin drugs, over time, what might happen? They start losing energy. The patients start feeling tired. They also can develop other conditions because we don't have enough ATP. You can develop diabetes, memory lapses, muscle aches and pains, what's called peripheral neuropathy, which means legs, pain and numbness and tingling in the legs, and a lot of other conditions. So these drugs, even though they, quote, lower cholesterol, but the question is, at what cost to the patient? And they have a great cost to the patient. I mean, a medical cost, I don't just mean dollars and cents. So we have to be aware of these. So when we take a thorough history of our patients, we obviously have to ask, what medicines are you on? And try to figure out, are these medications maybe contributing to their fatigue? And it's an area that's often not discussed too much in more clinical and more traditional practices. So keep in mind, when you're on a statin drug, I always recommend, if you're not already doing so, to take CoQ10. However, I rarely prescribe those drugs anyhow, because there's so many other options. But otherwise, it's going to disrupt the normal mitochondrial function. Does anyone have any questions so far? Has everyone followed me? Yes?
How come all my statin doctors don't ever recommend the CoQ10?
Right. So the question, for the sake of the tape here,
I agree with you, by the way.
question was, how come most doctors don't recommend CoQ10 and put people on statin drugs? And they should, because it's well documented in medical literature that this is real, that CoQ10 is destroyed. A percentage of it is greatly diminished with the use of statin drugs. The problem is that most doctors only learn about medications, and that's who walks in their office with different pharmaceutical reps, and they tell them, here, use this drug. It lowers your LDL, lowers your total cholesterol. It's good for you. It helps lower inflammation, etc. But they don't really discuss anything that's more naturally oriented. And you can't patent CoQ10. So the pharmaceutical reps and the pharmaceutical companies have very little interest in studying it. Now, there was some talk a number of years ago of maybe adding CoQ10 in with statin drugs, by the way. But it never occurred. And I'm sure there was a lot of pushback on doing so because it's a natural agent. And when you're talking natural agents, a lot of doctors just have a knee-jerk reaction against them automatically. It's no good. That stuff's no good. There's no literature behind it. There's no this. There's tons of literature behind this one, by the way. When you get home, feel free to Google CoQ10 and statins. You'll see whole lots of articles populated, by the way. Anyhow, so getting back to the medication still. Now, millions of Americans are on various antidepressants: Prozac, Wellbutrin, Lexapro, Zoloft, right? So how many of those patients who are on those drugs do you think have a deficiency in their body of Prozac, Wellbutrin, Lexapro, or Zoloft? Anyone want? Basically, it's zero. Thank you.
Zero.
You said it. Yeah, thank you. So the answer is zero. Not one of those patients truly, they don't have a deficiency of Prozac. Come on. It's a pharmaceutical agent that was developed by a company. They don't have deficiency, but maybe they have deficiencies of other things in their body that is causing their depression or their fatigue. Or maybe they have excesses of things that aren't so healthy for us. So point is, they're rarely even checked for those things. The patient walks in the doctor's office, hey, I have depression, I'm tired all the time. Here, take this drug. It's a whole lot easier to write a prescription for one of these medications for an antidepressant than to do a thorough investigation as to what's happening inside their body to see why they might have this depression. So there's a common blood pressure pill out there. Some of you probably heard of it, called Norvasc. Well, nobody has a Norvasc deficiency. That's not how it works. They may have high blood pressure. They don't have Norvasc deficiency. So they're treating, they're treating the end result, the name of the disease, which in this example is hypertension or high blood pressure. But they're treating it with basically, I call it a Band-Aid. Right? They're treating the result. They're not treating the underlying cause. In fact, they're not even looking for the underlying cause. Right? They don't look for that. Walk in your doctor's office, high blood pressure, here, take this blood pressure pill. No looking for causes. Lipitor, we already talked about that. That's one of cholesterol. But then, everyone with high cholesterol, nobody has a Lipitor deficiency. It doesn't exist. So anyhow, but that's the mentality. And so in my opinion, it makes a lot more sense to treat the cause of the deficiency rather than treat the result of the deficiency. Or imbalance, and maybe I should use the word imbalance, or metabolic imbalance may be better. So anyhow, so we have to start looking for the root causes rather than just masking the symptoms. And so what we've developed here, and I'm not the only person who wrote it all, but if we've developed a personalized approach and what's called a functional medicine approach. Some people call it integrative medicine. And so the idea there is, number one, every person's different. I think that's pretty obvious. If we were all the same, we would then all look exactly the same. Well, I don't see any two people in this room that look the same as the next person next to you, okay? Plus, we all have different genetics. We have different environment. We have different looks. We have different everything, okay? In traditional medicine, we kind of treat everybody the same who has the that named diagnosis. So if someone has diabetes, you choose 1 or 2 or 3 or 4 drugs that are out there, and you treat them the same way. But for one person, their diabetes might be caused by their diet, another person their exercise, another person their stress, another person maybe they're drinking out of plastic bottles, 4 bottles a day, which can cause diabetes, which we can mention in a few minutes. Or maybe it's more genetic in their nature for that patient. There's so many different reasons. Do they have high levels of lead or mercury? And I saw a lady today with high mercury, and she was diabetic. Do they have low minerals such as chromium, magnesium, and zinc, which can contribute to diabetes? These are all different reasons why a person can have diabetes. All right, come on in, have a seat. So anyhow, so we really have to individualize our treatments and our approaches to each patient. Because to treat everybody the same, to me, is ludicrous, and it doesn't work well. And that's part of the reasons why with chronic diseases that we see, the results aren't so good, because we're treating everybody as if we were the same. And so there could be 10 causes of, for example, diabetes. Even with breast cancer, I see a lot of women who have breast cancer here, and men with other cancers. In traditional medicine, we treat them as if the cause is all the same, because they're treating the result once again. They're really not treating the cause at all. So anyhow, so also in personalized medicine, functional medicine, we are more proactive. We're trying to figure out, is this person healthy? And if they're not, what can we do to make them healthier? What can we do to protect them and prevent them from developing disease? Let's face it, heart disease is #1 cause of death in America. And as we get older, we're much more susceptible to heart disease. Cancer is #2 cause of death. And so unfortunately, it's an epidemic almost today. But if we can do things in our lifestyle, our diet, everything else we're doing, which we'll talk about, we will be much healthier and help protect to some degree. And so so everybody, we can bring down the numbers of these diseases greatly. And another one is Alzheimer's. Alzheimer's is on the rise right now, dementia. Part of that is they call it type 3 diabetes. It's because our diet is so high in sugar and sweets and processed foods that our body can't handle, and it's causing brain dysfunction. So once we start changing people's diets at an earlier age, and we get the kids who are in school age, if we can, to get them to understand a healthy lifestyle, healthy existence. So that's part of what we do with what's called functional medicine, and we're looking at much more within the detailed labs, looking at the cellular level. And that is very different from, I showed you earlier, how with conventional medicine are mainly looking at a CBC, the blood count stuff, and CMP, which is the comprehensive metabolic profile. And that's all they're kind of looking at. Well, we have to go way deeper than that. Those things, once again, are the reasons. You only have abnormalities when things are at a later stage. By the time you develop anemia, which means a low red count, sure, you'll find that. But before you want to pick up warning signs before a person is anemic. All right, so I developed, a number of years ago, 2012, wow, a way of a paradigm for how to think about my patients. Because I attend many, many conferences. I probably go to 4 to 6 a year for the last 30-something years, 35 years actually. And I began to say and see that virtually all chronic diseases have common denominators. Virtually every one of these have probably one of at least these 12 factors that may play a role in why we get sick in the first place. And they all sort of interact with each other. It may be hard to see some of this in the back of the room, I realize that, but basically it's things like nutrient imbalances, absorption and digestion troubles, food intolerances, mitochondrial dysfunction, hormone dysregulation and neurotransmitters, what's called oxidative stress, stressors in general, electromagnetic frequencies, detoxification, environmental chemicals, genetic factors, and then also inflammatory and autoimmune factors. So all these things play some role, not in every person, but can play a role in why we develop chronic disease. Now the problem is very few conventional doctors even look at these things. They don't even assess any of those 12 parameters. They only, once again, look at a CBC and chemistry profile, and maybe a thyroid, and maybe lipids. That's not enough because we are all individual, and these things can interact with each other. So that's how I think when I see a patient that tells me they're fatigued, I start by taking a very thorough, detailed history, trying to figure out where do I start? What do I tease out from here? And which one of these 12, or could be 2 or 3 of them, are most important for me to start looking at? Is it their adrenals? Is it their neurotransmitters, their hormones, their vitamins and minerals? Do they have toxic metals in their body? Are they exposed to too many pollutants from the environment? Are they working on a farm and exposed to pesticides, herbicides, fungicides that may be in their body? So all these concepts need to be addressed if a person has almost any chronic disease, because you won't get rid of a chronic disease just by using prescription medicines. You may cover it up. You may cover up the symptoms, but they'll still have that disease. So, a high blood pressure pill, they still have high blood pressure. If they get off that pill, the blood pressure is still high. So if you didn't solve anything, you didn't cure anything, you're managing it a little bit. So it's a very different mindset. So in general, the best treatment for any disease is not to get it in the first place. Let's face it. So that's what we're here to do, is try to protect and prevent. And almost every chronic disease has some fatigue and tiredness related to it. Almost every patient with chronic disease says, hey, I have some fatigue and tiredness. So the next area I want to mention is a little bit about foods we're eating. Now, unfortunately, our food supply has become very devitalized. It's been genetically engineered. It's become problemsome over the last 50 years or so in this country. So all of you maybe have heard of GMOs, which means genetic modified organisms. They started that, Monsanto started that around 1990, those 30 years. But beyond that, they started adding sugar to our foods almost 100 years ago now. And they started processing, refining flour and bleaching it as well around that time as well. The average American eats about 150 pounds of sugar per year. Now, there's people in this room who don't even weigh 150 pounds. Some of us weigh more, but the point is we're eating our body weight, approximately, in sugar per year, which is astronomical. Now, once again, they didn't start adding sugar to everything until maybe 100 years ago, but the amount of sugar in our foods today is far greater than it was 10 years ago. And 10 years ago was far greater than it was 20 years ago, and 30 years ago, 40 years, keep going on and on. The amount of sugar added to our food just keeps going up significantly. We feed our kids for breakfast, what do you give them? Half the time cereal. It's loaded with sugar much of the time, Pop-Tarts. And then how many Americans are drinking sodas as their one of the major drinks? There's about 10 teaspoons of 10 teaspoons of sugar in 1 can of Pepsi or Coke, just 1 can. So if they're drinking 3 and 4 cans a day, which some people are, 30 to 40 teaspoons just from drinking soft drinks. Okay, and then you add all the other things into it. But now, so that's partly why we're seeing more obesity than ever before, more diabetes than ever before, contributes to high cholesterol and high triglycerides, and more fatigue as well, because once your blood sugar goes up, then you've got this big drop off, people have a valley, and they feel very tired after eating sometimes. So anyhow, we need to really look at what we're eating and try to improve the quality of our food intake and get people to understand, eat a wholesome foods. It's less processed, less refined, as best we can. Okay, so the foods that we ingest every day is one of the biggest burdens on our immune system that there are. And the decisions that we make every day, we should think about, is this food, when I tell my patients, when you're going to eat something, think about, is this food going to be probably health enhancing or health perhaps inhibiting? And we know the answer. We go have a piece of cake, we know it's going to be health inhibiting. Eat an apple or spinach salad, it's going to be more health enhancing. Pretty basic. So I'm not saying it'd be, no one that I know too well is 100% perfect, but make proper decisions that are intelligent as best as you can, as often as you can, because this is what gets us into trouble. So, we're eating 3, 4, 5 times a day, and we have to think about, is this a proper decision for us? Is this going to cause us to be in better health or not so much? Plus, we are the first, or some of us now, depending on who we are, second generation in this country to be eating the kind of foods that we're eating today. And I remember when I was a kid, my mother would take us to a farm to get corn. And we would look at the corn and try to find the ears that didn't have the wormholes in them. How many of you don't see too many wormholes anymore in corn? And the same thing with apples. I would go to an apple farm, apple orchard, and try to pick the apples off the trees that didn't have the holes in them. Now you hardly ever see wormholes in an apple because they're much more sprayed. And the ground has artificial fertilizers in there, and it's a whole different world today than it was back, 70 years ago. So I also tell my patients, try to eat the way your great-grandparents probably ate, okay? Because it's back to basics. And in those days, too, we didn't have to worry as much about organic versus non-organic because almost everything was organic back 75 and before, maybe 100, 75 to 100 years ago and before that. They didn't spray everything. Now, you have to go to an organic farm to get it nowadays, but before, you didn't have to worry about that. And everything is sprayed. When I was growing up, if you drank sodas, not that I didn't ever care for sodas too much, but still, they came in glass bottles, and you remember that, and you remember that, and you guys, you may not remember that. But I know, I was going to see you too. But regardless of that, so you guys remember. So it used to come in glass bottles, and I tell my younger patients, because they're only used to stuff like that coming in plastic today, right? But back in the day, it all came in glass. So you might be thinking, what the hell's wrong with plastic? Well, the plastics have what's called plasticizers in them. And one of the common ones is called BPA. It stands for bisphenol A. And this is a very strong what's called endocrine disruptor, which means it messes up our endocrine system. Well, part of the endocrine system includes our thyroid. And if our thyroid gets diseased, we feel tired, right? But the endocrine system also involves our pancreas. Well, if you're exposed to enough chemicals, most of the chemicals in the environment are what we call endocrine disruptors, and they are what's called mitochondrial toxins. They disrupt these mitochondria that I mentioned earlier are so important for energy, and they mess up our endocrine system. And so our glands don't work well. The adrenals, the thyroid, pancreas are just a few of them. And so this is part of the reason why we get a lot of fatigue too, because we're all exposed to so many chemicals today, and we can't get rid of them. Our body, it gets stuck in our body, and we can't get rid of them. Yes?
So the majority of water are in plastic bottles.
Yes.
Would you advise not to drink water out of plastic bottles?
So the question was, most water is in plastic bottles. Say, what do? I advise you not to drink out of plastic bottles. Yeah, I would. I would tell you not to drink out of plastic bottles, that is, if you can. Now, it's hard, depending on what you're doing, and you're running around, and you're at work. And so I tell people, look, take some water in glass if you can. Also, they do sell some of the stainless steel containers as well. Obviously, they sell, what are those things called that stay cold all day long now? So into that. Yeah, Yeti. Is that what it's called?
Yeah.
Something like that. Yeah.
This works too.
That works too, okay. So there are some things, there are plenty of options and alternatives today because people are becoming more aware of that today. So it's hard. But it's the single-use plastic that's the worst, by the way. Soft, malleable plastic is the worst.
Okay.
So, and it's not just plastic, I don't want to just pick on plastics, but there's so many other things which I'll show you in a few minutes.
May I ask a question?
Sure, please.
Water from the water coolers.
Right.
Is that plastic? It's harder. Is that?
Okay, so yeah, there's water coolers. Yes, many of them are harder plastic, and that's not as troublesome as a softer plastic. So not perfect, but it is a whole lot better. So when we renovated this building about 2.5 years ago, and I put in upstairs and downstairs water filtration system in here. And so we had that hard plastic stuff before for the last 30 years. And I got rid of it 2.5 years ago and remodeled. And so now everything's just coming, it's special filtered water that we have here. And by the way, the cup I'm drinking out of here is made of plant. It's compostable, and it's made of plant material. So it's not anything that's harmful or synthetic to me or to our environment. It can go in a compost pile too, which is kind of nice. So even we started here too, and I got rid of all the plastic utensils that we had. And the oceans are getting polluted now with plastics, as you guys know, and even the plastic bags that you get at used to get at supermarkets, you don't get them anymore. And they're banned in some countries or some of the states here now. So we have to be more conscientious about what we're doing. We're polluting the oceans. By the year 2050, they estimate that there'll be more plastics in the ocean than there will be fish, as far as weight, than fish in the ocean. So after, around that time, who knows if there'll be any fish left in the world after, 2040, 2050, 2060. Maybe not. Our grandchildren may not even know what a fish is. They'll think it's some prehistoric thing. It may not exist anymore. I don't know. But if we continue in this path, by the way, now hopefully people will start taking some control, not control, but responsibility for themselves. But we got rid of all the plastics here as far as our forks and spoons and knives in our lunchroom, and we have plant-based utensils now. So I think that's a lot healthier for us as well as the environment. So we have to really think about what we're eating, but also other things that can cause a lot of fatigue. Not just fatigue, but depression and chronic diseases. There's other things too. We might be sensitive to molds. I had a lady in today that was had some complaints, and she told me that her basement's very damp, and she's been feeling lousy. And we were talking about that. I'm going to run some special testing on her to check for mold problems on her now. But anyhow, so molds are a big problem that can cause us to feel lousy. And of course, if we are sensitive to pollen, such as grasses, trees, and weeds, also danders from dogs or cats, for example, other animals as well. And you know, a couple times I mentioned chemicals, but you know, there are over 85,000 chemicals in production today, by the way. 85,000, 8,500. And many of these have not even been tested. Well, many are potentially cancerous, but none of them haven't even been tested for that. And then so we're seeing this upswing in cancer, not only more of it, but in younger people today. I've seen so many people in the last 5 years who have had cancer now who are below the age of 40, and I never saw that before. They were, you know, older people. Now it's not always the case anymore. And it's not just that. We're seeing more and more what's called autoimmune diseases, and in younger people too. And it's partly, once again, these chemicals of varying sorts can disrupt the immune system and the endocrine function and these mitochondria, and it's contributing to autoimmune disease. So something called Hashimoto's thyroiditis, something called Crohn's disease, rheumatoid arthritis are examples of autoimmune diseases. It means that your body's reacting against itself. It's making antibodies against itself. Okay. Any questions right now? Okay, keep going. Okay, so it's very important. What I often will do with patients, I had a lady today, and she was a mess, and I had everything wrong with her, lots of complaints. And I said, listen, why don't you do yourself a favor? Go on a 30-day elimination diet. She said, what's that mean? I said, let's eliminate 5 major food groups that she was eating a lot of. I said, dairy, wheat, corn, soy, and I told her alcohol in her case because she was drinking a bit too much. So I said, let's avoid these 5 major groups. By the way, dairy and wheat are very pro-inflammatory, and a lot of people can eat these and they get very tired after eating. And that's one of the major symptoms of food sensitivities is, are you tired after eating? And people don't realize it because you eat so many times a day that we're just in a stupor all day long. We don't realize that we're tired from the foods that we're eating. So anyhow, if you're interested, you know, one of the things to try if you're not feeling well is go on like a 30-day elimination diet. There's a very good website if you're interested. It's called Whole30.com. And has anyone ever looked at that one? No? Okay. So if you want to look at it when you get home, it's pretty good. And it's elimination diet you do for 30 days, and it guides you through it. And I explained to my patient today, listen, this isn't a, what's the word, punishment to you. I said, I'm hoping that, because she didn't want to do it at first. I said, I'm hoping you've been to so many doctors and feeling so lousy for so long. I'm hoping that you start feeling better. And so this is, you know, a gift. If you're feeling better, this is going to be a wonderful thing for you. So don't look at it as a punishment, you know. I'm here to help you out. So anyhow, and then the other problem is, for various reasons, we sometimes don't get rid of our pollutants and toxins in our bodies so well, the detoxification pathways. And there's ways of assessing that too. So the more junk that we eat, the more exposure to chemicals, the more that our detox systems become impaired and gunked up, and they don't work well. And that's another common cause of fatigue. So, you know, when we eat a lot of like even baked products and margarine, they contain something called trans fats, okay? And these trans fats are very abnormal molecules to our body. Our body doesn't know how to handle them. We can't get rid of them very easily. And they get stuck in our membranes. Every single cell is a membrane. You can envelope around it. We can't get rid of it well. So there's detox methods that we have to use. It's very important that your doctor, in general, takes a thorough look at your environmental history. And I know that most doctors don't even do this. They don't ask you, you know, hey, look at someone today. I asked about her renovations. I asked about her, did she get any new furniture, paint her walls? Did she get any new flooring, new carpet? Is anything wet in her house, you know, with water damage? Does she have an exterminator that comes? Does she burn wood in the fireplace? All these things are potential problems for why we feel lousy, whether it's fatigue or something else. And if we don't take a thorough history, we don't ask the questions, we'll never know. And so it's important that a doctor takes a very thorough environmental history as well as a dietary history and asks you what you eat and everything else as far as what you're doing with your lifestyle. And not only a history about the environment at your home, but what about schools, workplaces? All these areas are equally important because we spend time at these other places. I spend more like that here at the workplace. Okay, I spend less time at home, no longer in school. Cleaning agents. So we clean our house. We spray different. I don't want to name brands, but you guys know what I'm talking about. So and they aerosolize, and some of them are fragrances, and we can feel pretty lousy if we're sensitive to these fragrances. But even so, they are also endocrine disruptors. They disrupt the endocrine function, which includes those glands that I mentioned to you. So I tell my patients, try to find more what's called environmentally friendly cleaning agents. And they can go to the health food stores and the supermarkets that sell these kinds of things. You can go online if you want. There's more and more companies that are now making safer cleaning products for all of us. We're all exposed these days to computers. We're exposed to cell phones. And there's different wavelengths of energy that probably aren't so terrific for us. And there's a lot of debate right now about the Wi-Fi, it's called the 5G, right, 5G, yeah, thanks. And there's a big uproar about this today, probably rightfully so. I mean, these energies are emitted and we don't even know half the effects of these things. It's all new technology, this stuff. And then we're seeing, an uptick even in brain cancers today, in brain dysfunction, in Alzheimer's and dementia, and ADHD and autism. We didn't have this stuff 50 years ago like we're seeing today. So I can't blame it on that stuff. That would be responsible of me. But I think that it probably has something to do with it, at least. Believe it or not, even root canals, there are dental problems, dental things in our teeth, probably have some effect also. Because it's the only time that humans, that we, leave dead tissue in our body intentionally. In other words, a root canal is a dead tooth. And you go to an endodontist, they do a good job. They do what's called a root canal. Anyone ever have that? Mm-hmm. I did. I have. You have too. And you have. So there's 3 of us here. And they're not healthy for us, probably. I mean, there's a lot of debate about that. I don't have all the answers. But I just want to tell you, there's some suggestion that people that have root canal on the left side of their mouth are, at least for women, are at higher risk for breast cancer on the left side. She's heard that. And there's plenty of that type of stuff going on. So, yeah. So anyhow, so we really have to pay attention. And so we take a thorough history for our patients who are fatigued. We have to ask the questions, because if you don't ask, you don't know. And it's the only way you're going to try to figure out these things. So I mentioned the term mitochondria a few times. There's 2 common denominators, and this is one, that occur with almost every chronic disease. And that is, one is called low mitochondrial function. Now, mitochondria, I mentioned, makes cellular energy. It's something called ATP. But without the proper energy, we can develop chronic fatigue. We also can develop heart disease, cancer, fibromyalgia, aches and pains in the muscles, autoimmune diseases, autism even, neurodegenerative problems, meaning dementia, and memory lapses and stuff like that, and much, much more. So most chronic diseases involve the abnormal utilization of oxygen. And in the mitochondria, you need to have proper oxygen utilized in order to make this stuff called ATP. You also need that CoQ10 that I mentioned earlier. You need a lot of things. It's a whole sequence of events that happen. But oxygen utilization is one of the major things that affects the mitochondrial function. And if we don't utilize, if these mitochondria aren't working well, we don't work well either. So if we take a look, I said it's one of the common denominators for virtually all chronic disease. So what happens is we don't get enough oxygen utilized by our tissue. It has nothing to do with us breathing right now. So even though we're all breathing oxygen, we assume that there's 21% oxygen in this room. It doesn't mean that we're all pulling that oxygen and utilizing it in our tissues equally, because we're not, by the way. Because there's various things that will affect utilization of oxygen at the cellular level, many, many things. But anyhow, so if we're not using the oxygen properly, we develop low energy. We don't have the energy to do things. And by the way, oxygen is the most important element known to mankind. We can't live more than 5 minutes, approximately, without oxygen. We can live more than 5 minutes without everything else, whether it's vitamin C, zinc, copper, magnesium, chromium, you name it, without water. We can live more than 5 minutes without everything, except for oxygen. So it's very important. Anyhow, so if we don't utilize it right, we develop what's called a low oxygen state within our cells, which leads to something called oxidative stress, and then it can lead to this mitochondrial dysfunction. That's kind of how the sequence works. By the way, I have to thank my son. He made all my slides for tonight. And so he did a good job. I like that. So I was like, oh, that's pretty nice. I could have done that. I wouldn't have been doing this stuff. So anyhow, anyhow, that's that. By the way, so what is oxidative stress? It's one of the precursors for that, for mitochondrial dysfunction. You might think, what's oxidative stress mean? So think of a nail. You go to Home Depot or Lowe's, I don't mean anyone versus another, and you buy a nice shiny silver nail, brand new. Leave it outside for a week, 2 weeks, 3 weeks. And it rains, it's humid, it's sunny, it rains again. What happens to that nail after a couple weeks?
Rust.
It's exactly what that's called, oxidative damage to the nail. The same thing happens to us. Okay? We rust in a way too. If we're out in the sun too much, what happens? We know in our skin, we get skin marks and darker marks. It's called lipofuscin. But we get wrinkles a little bit. So these things happen. We age. And that's all part of the oxidative stress, which leads to the dysfunction of mitochondria, and our body doesn't function well. It could be fatigue or something else. The second major, so the first major, I said common denominator is what? Come on.
Fatigue.
No, common denominator of all diseases.
Mitochondrial.
Mitochondrial dysfunction, good. This is now the second. Now, most of you haven't heard this term. It's kind of a new term. And it's called cell senescence. Anyone know what the term senescence might mean, sort of? It means kind of going to sleep. Okay? So when cells lose their ability, or healthy cells lose their ability to divide and multiply and do what they're supposed to be doing, and they no longer multiply, what happens? They kind of die off. Now, it's important that some cells do this naturally, because you don't want your cell to multiply forever. That's a problem. But they all should have a normal cycle to them. And when our cells die off prematurely, it's called cell senescence. Okay? They no longer multiply properly and repair themselves properly. So there's a few very exciting breakthroughs in medicine that I just started using here recently within the last year or so. And we've seen amazing results so far. And most of you haven't heard this yet, I believe. But it's called peptide therapy. And there's other forms of regenerative therapies that we're using now too, to help slow down and reverse cell senescence. So you know all those people that want to live longer, and they go to anti-aging places, and they go to longevity centers. They go there in part to slow down cellular aging, and they slow down oxidative stress, and they help improve mitochondrial function. So there's a wide range of a new therapy that we're utilizing. I have dozens of patients on this treatment now called peptide therapy. Peptides are short chains of amino acids, less than 50 in sequence. If you have more than 50 amino acids together, it's called a protein, but less is called a peptide. Anyhow, so there's various peptides that have been now identified through scientific research that help to improve our cellular function and help to reduce cell senescence. What they do is they help repair where there's damaged tissues. They help to regenerate and rejuvenate tissue. So even like for brain deterioration, people are developing memory lapses, people are developing who have MS, Parkinson's, and Alzheimer's, and people with weak heart muscles. They're finding out now there's certain peptides that may help to regenerate some of these tissues. There are dozens of peptides, there's not one. And a doctor who's trained in this has to select the ones that he or she thinks are best for that condition, best for that patient. What they do is they also help with something called cell-to-cell communication. So it helps your cells, cell A, communicate with cell B. Because if there's a disconnect, they can't repair themselves. And they help with cell signaling, is called, and cell communication. If cells can't communicate, just like people, we can't communicate with each other, there's a dysfunction here. So we have to be able to communicate, and we have to be able to signal, to each other that things are going well. The same thing applies to our cells. And also, our cells are always repairing themselves, and this treatment helps to stimulate proper repair mechanisms within the body. They also are generally anti-inflammatory, and they are what's called immunomodulatory, which means it helps modulate our immune system. They do a lot of other good things too. Another area that I'm working on is with this other regenerative therapies is called exosome therapy, which I'm going to give a whole talk in a few months on this whole topic. But these are breakthrough areas in regenerative medicine to help repair the body. And various organs can get repaired now is what we're finding. Now I'm going to tell you that this field's in its infancy still. Do not have all the answers, but there's a lot of scientific breakthroughs. And if you just Google, when you go home, I already told you, Google if you wanted to, I think I said, whole30.com. If you want to Google the term peptides and stick in the term. Put in peptides and cancer. Put in peptides and autoimmune disease. Stick in peptides and neuropathy. Peptides and brain deterioration or brain dysfunction. You're going to see a whole lot of articles pop up. And it's a fascinating field. I just came back 2 weekends ago from, I was in a conference in St. Petersburg, Florida, and it was put on by the what's called International Peptide Society. And it was fascinating. There were over 250 to 300 doctors there, all interested in learning more about this field of regenerative medicine. So we're doing a lot of that here now. Anyhow, so the next thing I want to go on, and we're going to try to speed up, is how do you know if you're healthy? So, you know, people come to me, or just some people come and say, hey, I don't know if I'm healthy. How do I know? So most doctors, as you've been to, are just going to do a CBC and a chemistry profile. That doesn't tell you enough if you're healthy or not. So we go deeper. So let me just show you quickly how we gather information, how we gather data, so that we can see how is a person healthy, or are there risk factors that we need to address, or especially if they're complaining of fatigue, are these some of the things. So believe it or not, in the field of what's called personalized functional medicine, these are some of the different labs, not everyone, they're the majority, of some of the different kinds of labs. It's not the brand names, it's just the generic words for some of the different labs that we are doing. And I was going to go through all these, but I'm not, because it's getting late. So, but I just want to explain to you that these go well beyond, they go beyond the tip of the iceberg, and they go at the foundational level of where we are to make sure that you're healthy or not. So another area that's really problemsome in conventional medicine versus what we're doing is the concept of normal range versus optimal range. So how many of you had vitamin D measured at some point by a doctor? You did? Okay, good. Over half. And the vitamin D range in the blood is quite broad, by the way. It's from about 30 to 100. So you could be at 31 or 32 or 33, and what's your doctor tell you? You're fine, right? Probably, right? You've heard that, right? But you can be there for double that number, be at 66, let's say 33 to 66. And what's he also tell you? You're fine, you're within the normal range. You could be at 3 times that number, be at 99, and you're also within the normal range, and you're fine. So you can be 300% higher than what that initial number was, and all be told that you're fine. What I want you to know is that for some of these things, these are 3 different labs that can be looked. The ranges are so broad, and it's very important that we try to figure out what's the optimal range for each person, because it's not the same, and those are generally much higher in optimal range versus just, quote, the normal range. Normal range is so broad for some of these things, and it doesn't put you in optimal wellness, optimal health. It just gets you to get by, treading water. All right, so we do check hormones sometimes, a lot of times. Hormones, not only sex hormones, but the adrenals and thyroid hormones, especially with fatigue. It's a big area to look at. I'm just going to blow through these, but we do check what's called functional vitamins. So we check about 40 different vitamins and minerals, because you could be deficient in different things, and these play a great role in whatever your disease process might be. No matter what your disease is, having low levels of vitamins or minerals or amino acids can play a role in why you're not feeling up to par. This is a fascinating field. This is measuring what's called telomeres. Anyone ever hear of telomere? Besides you, a couple of you, good. So telomeres are they're the caps at the end of a chromosome. And what happens is with cellular aging, as we get older, the telomeres begin to shorten. And that's what they found, is that with cellular aging, telomeres shorten. So a lot of people come to me and they're just here for rejuvenation, regeneration, and wanting to feel better, and prevention, basically. They say, oh, their mother had a heart attack at age 52, their father died at 58, and they're now, 55, they want to be around longer than that. So we might take a look at some of the, we talked about how do you know if you're healthy. You might take a look at your telomeres to see, are your telomeres too short, or are they, it's better to be long for telomeres, okay? So we can take a look at that too. I know it's hard to see some of that. We may do a very thorough analysis of your different hormones in the body, male and female. Primarily we do females for that particular test there. But it also looks at the adrenal metabolites, and that side's more of the sex hormones. And we take a look at that. Stool. So there's a lot of work being done in something called the microbiome. You've heard of that term, many of you. And this is a fascinating area. It's growing immensely. The traditional medical doctors and hospitals and medical centers, universities are all looking at the microbiome today, which has to do with our gut flora. And we're finding out now if you have altered gut flora, it can lead to almost any disease you can think of. So between all the antibiotics we're taking, which destroys the microflora, and between many of the other medicines that we take as well, it disrupts the normal balance. This is now contributing to some of the chronic disease we're seeing, including fatigue too. Heavy metals. Well, you might think, oh, I don't have any heavy metals in my body. Believe it or not, we all have some. We're exposed to this stuff through the drinking water, through our food, through the environment, through the air. We all probably have some of the stuff in our body. The problem is if you only look at it in blood, you won't usually find it. There's other ways of looking at it. This is a urine test, and you won't find it in the blood frequently unless you have acute exposure, meaning high level of exposure right now, because what happens if you get exposed, it gets hidden. It goes into your bone or tissues, so you won't find it in the blood most of the time. So we have to once again look where it might be hiding, and it's hiding in the tissues in the bone. This is a test looking for what's called DNA oxidative damage. If there's damage to the DNA, you're more prone to almost every chronic disease. You don't know this unless someone tests you. And the conventional doctors have no idea what this is all about most of the time. This isn't their field of expertise. And unfortunately, we think it is. We expect them to know all this. This is not their area of expertise. It's a different language, and it's not saying one's right, one's wrong. It's simply a different vocabulary and different way of thinking. This is all part of looking at how the body is functioning and looking for early warning signs. If you have DNA damage, you're more prone to heart disease, you're more prone to cancer and other conditions too that aren't so pleasant. This is looking at some of the toxins in the body. Like this has to do with what's called volatile organic hydrocarbons. Even things like xylene and benzene and styrene and pollutants and organophosphates and all this other stuff that's not so good for us. We can actually measure some of this in your body, which is crucial because we're all exposed to this. Anyone know what glyphosate is? It's the chemical found in Roundup. You got it. So, generally speaking, 100% of Americans have some measurable levels of glyphosate in their body, unfortunately. And this is involved with this whole GMO concept. So we do measure it in some people. This is a sample, but this sample person, it was quite high in glyphosate. So I need to counsel that person if this was my patient. And we need to talk to him or her and explain, hey, maybe you should start eating more organic foods. We have to put them on a detox program. And because this person's holding on to the glyphosate, which is unhealthy for them. It punches holes into the intestinal tract. It causes something called leaky gut syndrome, which can lead to terrible fatigue and other problems. It goes on, and there's some suggestion may contribute to cancers. So we have to look at the whole body, and I really want to emphasize that here tonight. This is looking at mycotoxins. This is mold toxins, mold spores that your body might be developing. So the lady I had today, I mentioned earlier, I gave her a kit to do a mycotoxin test. So we can see if she has excessive mold spores that may be contributing to fatigue and depression and aches and pains and fibromyalgia and autoimmunity. Very important. And then this is, okay, so the number one cause of death I said earlier was heart disease, right? See if you're listening. Anyhow, so, and unfortunately, a lot of people don't know they have heart disease until it's too late. Something bad happens. But anyhow, so there's more advanced testing that should be done, or could be done and should be done. So it's not just looking at your LDL, HDL, triglycerides, and cholesterol. You have to go beyond that. And that's what we're doing special testing on, so we can identify who is at greater risk or greatest risk for developing heart disease, cardiovascular disease, stroke, sudden death, heart attack. And we don't want to wait till it's too late. We want to pick up early warning signs before these catastrophic events might occur. So there's ways of looking at that with more advanced specialized testing. And the metabolic part is mostly for diabetes. And diabetes is on the rise in this country. And a lot of people are what we call have insulin resistance or pre-diabetic. It's better to be, identify that so we can then counsel the patient so they don't have to develop diabetes. It's a horrible disease once you develop it. So if we get things earlier, the warning signs and the biomarkers, it's called biomarkers and the risk factors, it's a whole lot more efficient. And this is part of that test I just showed you back here. help to identify, because of different inflammatory markers we measure, what's happening perhaps in your blood vessels. And I said that heart disease is #1 cause of death in the United States. Well, we have now tools to identify who is at risk before they develop the actual disease. So we can look at who's just at risk for developing disease, who has the presence of it, and then who has actual activity, which is real troublesome. This is when a stroke may occur because the plaque, this yellow stuff is plaque, becomes what's called vulnerable, and it can rupture. And that's when a person can get a clot, can get a stroke, or a heart attack, or sudden death. Right? So if we can pick this up years in advance and counsel that patient and try to identify what these risk factors are, these things up here, which I'm going to give a special lecture just on that someday. This is crucial for staying well and staying healthy and preventing disease. All right, so there are various things that help us with energy. Now, in my office, we use a lot of nutrients because we try to use the natural things we talked about earlier. And so we use a lot of oral agents. We use some intravenous agents. We modify intake, food intake. We have you definitely exercise and stretch as best you can. Healthy sleep is important. We want to reduce the chemical exposures, and our mind is crucial too. Don't forget about that. Our positive thoughts, our positive actions, our positive attitudes are crucial. For those who are just negative all the time, those people drag not only themselves down, they drag us down. So it's very important. By the way, exercise is, we all know its benefits, but the benefits you may not know. The exercise actually stimulates your natural production of healthy stem cells. And that's how we can develop many more natural stem cells that are healthy for us just by doing exercise. The other thing that can help us with developing more stem cells is the middle one, intermittent fasting. So how many of you have heard of intermittent fasting? Mm-hmm. Yeah, several. So that's kind of like, just eating within a small window each day. More and more people are starting to do that, and they're showing some great benefits with that. But one of the reasons it works by many mechanisms, but it has been shown to stimulate your own natural endogenous stem cell production. And we do want healthy stem cell production because it keeps our cells healthy and youthful. But yeah, so meditation, deep breathing, very, very important. Can't forget about that stuff. We know that many chronic diseases do have a component of the mind-body spirituality associated with it. It's also important that we have, enjoyment in life. We have hobbies that we enjoy to do. That's, these things are really important too. It's not just the physical, it's also the emotional and spiritual stuff that we have to take into our being as well. We can't neglect that stuff.
Deep breathing. Deep
breathing is crucial, yep. By the way, about 3-4 years ago, I had a meditation weekend here. It's not here, but down the street. And I brought in a doctor who's a meditation expert from California. And we spent a whole weekend. We had about 75 of our patients there. And my family and some of our staff. And we actually learned how to meditate over the weekend on a Saturday and Sunday. It was fascinating. But it's so important because it takes the stress off the body, and it lowers the cortisol release and the epinephrine, norepinephrine release. And this helps lower blood pressure, gives you a sense of calmness, and it just helps in so many aspects of healing the body. So there's a lot more than just the physical. I just want you to know that. That's part of it. So we talked about all these things, but also obviously some of this is too obvious. I didn't really discuss it much, but we don't want to smoke too. We don't want to smoke. We don't want to drink too much alcohol. We don't want to be too. We want to keep it ideal body weight if we can. By the way, there was an article published yesterday, and that's why I put the word antibiotics here, question mark. They did a study, and I have to get the actual study. It was like one of these news reports I get every day, and it talked about the fact that there's an increased risk of certain kinds of colon cancer for those people who are on antibiotics very frequently, believe it or not, and because it disrupts and disturbs the normal microbiome once again, and we lose the protection that we need. So there's certain types of antibiotics. They didn't go into specifics, but they did say the more antibiotics you use, and they destroyed some of the anaerobic organisms, we're at higher risk of colon cancer versus those who are on on antibiotics very infrequently. So it's kind of interesting.
I just wondered if the antibiotics included those that were GI specific that you could put on, like Xifaxan.
Yeah.
Xifaxan.
They didn't get into that exactly, but I know what you're talking about. But they didn't get into that on this particular article. Now, they may follow up with this article with more research and start looking at which ones in particular are more troublesome in that regard. Yes.
External antibiotics falls into that category?
No. Well, this whole article was only internal antibiotics, oral antibiotics. It wasn't topical and it wasn't intravenous. It was people taking oral antibiotics. So anyhow, so wait. So what happened with my patient? I told you, a couple of you guys came with me, but I told you about my patient who came in here about 3 months ago and who had lots of things wrong. Like I mentioned, she had seizures from traumatic brain injury, and she had concussions and pneumonia and horrible fatigue and sleeping 14 hours a day and still feeling horrible, and stomach problems and nerve problems in her right leg. She was a mess. So what did I do? I don't even know. Hold on a second. No? Okay. So I didn't really write what I did. But
You sent her there.
I sent her there. That's probably he's right. He's got the best therapy of all. How come this isn't coming up? Shoot. I can't go reverse speech now. All right. So basically what I did is I put her on a regenerative program to help heal her damaged tissue, her damaged brain, her damaged immune response, her inflammatory responses, her GI tract, which in my opinion wasn't repairing itself. So I put her on a program that included some oral supplements, and I also put her on a regenerative program including certain those peptides that I briefly gave you an overview. And I put her on something called exosomes, and I also gave her some IV therapies to help rejuvenate her body better because she wasn't digesting well. And within 3 months, actually 2 months later, she, I believe I can't go backwards. All right. She wrote me a letter, which was really nice, and it was wonderful because she said she now has bounding energy. She's able to go to the gym and do heavy workouts every day of the week. She's now able to obviously take care of her now his 5-year-old son. Her aches and pains are almost completely gone, and she felt like $1 million. And she, in fact, I went to read the letter because she wrote on it. She wrote something like, I was very skeptical of this treatment. I didn't believe it would help me. And she said, I was amazed how well that I did. In fact, I just wrote up her case, the two of us. I wrote it up, and it's going to be appearing in an international magazine that's coming out, I think, towards the end of September. So if you guys give us all your email addresses, I can hopefully, when it's out, send you a copy of this article. So anyhow, so in conclusion, I want to tell you the slide said in the nutshell. I'll just read you. So keep in mind a healthy, nutrient-dense, anti-inflammatory-based food intake. And I gave you an article, not an article, but something I've written in a handout about some of the most important anti-inflammatory foods. It's in this article here on page 2. And on page 3, it shows you ones to limit or avoid because those are the most pro-inflammatory foods. So yeah, page 2 and page 3 are the main things I want you to look at when you get home. And you want to eat a wholesome, nutrient-dense diet. The second thing I wrote here is regular stretching or regular exercise. So even if you can't exercise, stretch. Most of us can stretch even if you can't exercise too much. So you watch a dog or a cat when you wake up in the morning, or wake up from a nap, I mean, what do? They stretch for 15 seconds before they get moving. Correct. We want to clean up our internal and external environment. We want to live a healthy lifestyle. We want to take appropriate nutrients, drink plenty of healthy water. We want to get quality sleep. We want to manage our stress, and we want to have positive thoughts. So those are some of the that is the concluding slide that I had here. It doesn't want to go backwards, but that's okay. So what I want to do is open up for questions. I also am hoping all of you would do me a favor and spend a couple minutes and fill out this last page on the far right, which is called Sick and Tired Event Survey. It's simply a survey about tonight's talk, and this way we get some feedback. There's 2 sides, by the way, and we get some feedback as to what we can do to improve in the future and what topics you might want to hear about in the future as well. And it's good for us to have feedback. But make sure we have your email address as well so we can send you the article I mentioned. And I gave you a couple other brochures and a couple other things that we're doing here too. So let's open it up. We have a couple minutes, and I'll be happy to answer any questions you have. You can all be silent. Yes?
Is there a multivitamin brand that you recommend?
So the question was, is there a multivitamin brand? There's a lot of good brands out there. There's a lot of lousy brands too. So what I would tell you, I don't want to name a brand exactly. Maybe I'll talk to you afterwards. Sure. But I would tell you, look for ones that tend not to have artificial colorings, artificial dyes, artificial sweetening agents. And I happen to like capsules better than tablets because they tend to get absorbed better because they dissolve easier in the stomach once they hit the stomach acid. Whereas the tablets sometimes studies have shown, like X-rays have shown, that some of them don't dissolve well. And hopefully they're going to be free of like corn and soy and other common allergens is what I will tell you. Okay, good question. What else? Anything else? Yes?
You mentioned the difference between a peptide and a protein.
Yes.
What's the difference?
So they're both made up of amino acids. So peptides are defined as less than 50 amino acids linked together. Proteins are defined as more than 50 amino acids together. So like a piece of meat, or whatever, chicken or whatever, we think in terms of, hey, that has lots of proteins in there. So that means there's a lot of amino acids in there to link together. But we'll use the term therapeutic peptides. They're used therapeutically. They are now being used medicinally. These short chains of amino acids are being used medicinally. So you go home, just Google peptides in cancer. You'll see whole lots of things populate. Peptides in autoimmune disease. And so they're funny names. Like thymosin alpha 1 is one of the ones that we're using a lot of. Something called thymosin beta. Something called BPC 157. They have different names predicated on the amino acid sequencing. And it's a new emerging field in regenerative medicine. What else? Any other questions?
You mentioned the 5 things. I had dairy, wheat, corn, alcohol. What was the other?
Soy. And sometimes, I will tell you, eggs too sometimes for people, some people. Those are some of the most common food allergens, sensitivity things. Yeah.
What about nuts?
Nuts can be up there, but probably not as high as, well, because we don't eat them as much, or most of us. But no, for some people, yeah, listen, there's plenty of people that are so sensitive to peanuts or strawberries or chocolate, they can't even get near it. Absolutely. But I'm just talking about in general here. If you take 100 of us, we're probably going to be more sensitive to those 5 foods. But also, wait, there's a difference too. The thing with peanuts and strawberries and maybe chocolate, those are more anaphylactic almost, which means you have an adverse effect like this that's really serious. The other ones I'm talking about more intolerances or sensitivities. And they may be delayed. They may occur 2 hours, 6 hours, 8 hours, 10 hours after eating them. Whereas the other ones are more rapid. There's different mechanisms by how that happens. But the traditional allergy testing, such as for peanuts, for example, will only pick up something called IgE-mediated allergies. We are looking, the ones I'm talking about with sensitivities and intolerances to, let's say, dairy or wheat products, those are more what we call, they're non-IgE most of the time, and they're delayed hypersensitivity. They're more sensitivities or intolerances. By the way, wheat, about 50, 60 years ago in this country, was changed drastically from what our ancestors ate. And it's become what's called hybridized and modernized. And that's partly because of this change why it's become very pro-inflammatory. The ancient kind of wheat, which is called einkorn wheat, shaking his head so he knows what I'm talking about, is much less troublesome for most of us. But because our body hasn't adapted within the last 50, 60 years to this new form of wheat that we're all eating in most of our society, in this country and most other countries today. Because once again, it was hybridized and modernized and industrialized, basically, is what's happening. And you may have heard there's a book out called Wheat Belly, another one called Grain Brain. David Perlmutter wrote that one. And it's all about how about the new wheat that we're eating is adversely affecting our brain function, our immune function, inflammatory pathways, stuff like that. So, any other questions? Yes.
Is the low glycemic wheat bread that they have, like at Wegmans and other places, is that still the bad?
Yeah, low glycemic wheat, maybe. I don't know, because I don't eat bread too often. But so I'm thinking that, it's probably not still great. It's probably still processed refined, but it may have less, whatever, like refined carbohydrate and less sugar than the other breads would have. So it is good to eat a low, what's called glycemic index type of diet, low glycemic diet. So like berries are generally a good fruit, if you're looking for fruits, by the way. They're generally lower in glycemic index, which means lower in sugar than many other fruits would be. Apples and pears are good too. Vegetables are generally all pretty good. Minor exception might be corn, peas, and white potato. But all the other veggies are probably pretty low in what's called glycemic index, which means they don't turn to sugar too rapidly, so they're good for us. Nuts and seeds are very good for that purpose too, by the way. They're low in glycemic index most of the time.
And then the 15, what is it?
The Clean 15.
Yeah.
Okay. So you may have heard of the EWG.org. It's a great website also. It stands for Environmental Working Group.org, EWG.org. But anyhow, so they put out every year or so what's called the Clean 15 and the Dirty Dozen. So if you want to look that up, you can. And what it is, it has to do with eating organic food, and that the ones who are, quote, the Dirty Dozen, those particular 12 or sometimes it's 13 or so, we should try to eat organic of those if possible, because they are the highest in chemical load, and they have the less, perhaps, protection against it as well. Whereas the Clean 15, if you can't either afford or aren't interested in buying organic, those aren't so terrible to eat the Clean 15 because they don't have as much of pesticide and herbicide burden as some of the others. That's a good question. All right, so with that, I'm hoping you'll fill out your questionnaires, leave them at the front desk. Make sure we have your email address somewhere so I can send you that article. And I want to thank you for coming. And next month, if you're interested, Dr. Meyer, one of my associates, will be talking about medical cannabis on the 25th of September. And then every month, we have different talks here on different topics, usually on a Wednesday night, usually the 3rd or 4th Wednesday of the month, and usually at 7 o'clock. So thanks so much for coming, and I appreciate you all being here.
Thank you.
Do you have extra pens?
Pens here. I'll give you my pen.